A 70 years old man undergo revision total hip replacement. 30 days post-operatively, the hip dislocates and pus discharging from the wound. He is systematically unwell with temperature increase, which is 38.5 degrees Celsius, WBC count or 19,000. And what is the most likely course of the action? That means a 70 years old man who is very old undergo total hip replacement, but 30 days post-operatively there is the infection develop in this area. So what we can do here, the options: lay open wound and apply vac dressing, hind quarter amputation, revision arthroplasty, removal of the metalwork and bone grafting, removal of the metalwork and implantation of the local antibiotics. So what may be the option? Because there is total hip replacement, that means the acetabular and the femoral head, the both component are replaced, and there is a metallic implant inserted. So what we can do? So first of all, this patient developed the osteomyelitis, that means the infection of the bone and bone marrow. That means the infection of the bone and bone marrow. So after revision total hip replacement, there is the development of infection in the bone and bone marrow of the hip area. And we know the most common cause is the Staphylococcus aureus, but other organisms such as Streptococcus species and Salmonella species, but this Salmonella species usually causes osteomyelitis in case of the sickle cell disease. And what are the clinical features? The clinical features are erythema, pain and fever. Pain, fever and erythema, it is the main clinical feature of the osteomyelitis. And what are the investigation? It is the X-ray, bone biopsy and culture. And treatment in case of the osteomyelitis, clean osteomyelitis, first of all medical treatment, then surgical. So first of all medical, which is antibiotic, and if not improved then surgical. But here the scenario is the different. Here the scenario is the total hip replacement. There means there is a prosthesis. So what we should do? First of all, we should remove the prosthesis or metalwork. It is the first line treatment for any type of the implant infection or the prosthesis infection. Why? Because imagine this is a prosthesis which is implanted in the area. So what happens when infection occurs in this area? Actually the antibiotic, it cannot reach to this organism area, because around the prosthesis there is a shell present, or there is a defensive area present. So for the treating of this prosthesis infection or implant infection, first of all we should remove this prosthesis, totally remove this prosthesis, and then give local antibiotic, then it will work. So in case of the any type of the implant infection and prosthesis infection, we should go for the removal of the prosthesis or removal of the implant. It is the first line treatment.